Good day, good afternoon, good evening, wherever you are in your part of the world. This is King B coming back at you with some more information that you can use. And you see the title of this article: Deadly Bacterial Meningitis is Spreading in the U.S., CDC says. Let's see what this article is talking about. All right. While allergies may be top of mind with the arrival of spring, the Centers for Disease Control and Prevention just issued a warning about some more pressing concerns. In a March 28th health advisory alert, the agency called attention to an uptick in invasive meningococcal disease in the U.S., according to the notice. This is mainly due to the Neisseria meningitis serogroup Y. As of March 25th, a total of 143 cases have been reported to the CDC in 2024, marking an increase of 62 cases compared with the same time in 2023. The CDC also warns that this variant of Neisseria meningitis serogroup Y is disproportionately affecting people between the ages of 30 to 60 years old, as well as Black and African Americans and people with HIV. Meningococcal disease can have severe symptoms and even be fatal, presenting most often as meningitis, an inflammation of the fluid and membranes around the brain and spinal cord. With the concerning uptick top of mind, the CDC asked that healthcare providers maintain a heightened suspicion for meningococcal disease, but the general public should be aware of common warning signs. And we're going to read on to learn what to pay close attention to. So you see the age group 30 to 60-year-olds, and he's saying Black and African Americans are people with HIV. And, you know, it's funny that this meningococcal disease is targeting certain people. But let's see what else this article has to say. Fever. According to the Mayo Clinic, the early warning signs of meningitis can be similar to the flu, developing over a few hours or days. One of these could be a sudden high fever. The number 2 symptom to look out for is stiff neck. Another symptom of meningitis is a stiff neck. According to Medical News Today, the neck is the most mobile area that meninges cover. So when they become inflamed, patients often notice this in their necks. Cleveland Clinic notes that this may specifically involve the inability to lower your chin to your chest due to the stiffness. Yeah, this is another article done right here. You see this right here. The officials issued an alert amid incredibly contagious mumps outbreak. So, wow, we got that going on too. But let's continue on with this meningococcal disease. Nausea or vomiting. Also, like the flu, meningitis can cause nausea or vomiting. Photophobia. The CDC notes that meningitis can cause photophobia, or eyes being more sensitive to light. Altered mental status. Among the more scary symptoms of meningitis is an altered mental status, the CDC notes. According to the Cleveland Clinic, Patients with meningitis may specifically experience confusion. And in the related article, doctor issues warning about measles again. Easier to get than COVID. Look at that. There's a lot. There's just a lot going on out here today. And we all have to be careful. Let's continue with the article. There are other symptoms of a meningococcal bloodstream infection. The CDC also warns of different symptoms if patients develop a meningococcal bloodstream infection. These may also include fever, chills, and vomiting, as well as cold hands and feet, fatigue, severe aches and pains, rapid breathing, and diarrhea. The CDC's health advisory alert states in other stages of this kind of infection, patients may also develop a dark purple rash. The CDC stresses that symptoms of meningococcal disease can be nonspecific at first, and doctors should be aware that patients may present without symptoms typical of meningitis. Still, because the illness can progress quickly and become life-threatening, it's imperative to get antibiotic treatment immediately, the agency says. As a preventive measure, the agency notes that medical professionals should ensure people are up to date on meningococcal vaccines. You can also ask your healthcare provider directly about recommended vaccines or booster doses for you and members of your household. So that's the end of that article, but let's go backwards and see what's going on with this measles. Was it here? Yeah, here we go. Mumps. Hold on, let's go to that was mumps outbreak. Well, let's do the mumps outbreak first. Officials issue alert amid incredibly contagious mumps outbreak. These are the symptoms. What's the date on this article? March 11th. Wow. And from COVID and the flu to measles and norovirus, there's no shortage of illnesses to be on the lookout for these days. But another new concern just popped up. On March 5th, the New Jersey Department of Health issued an alert urging individuals to be wary of mumps. According to the press release, officials are investigating an outbreak of 8 suspected cases of mumps in the state. They claim that all of these cases come from one family cluster located in Hunterdon County and may be related to recent international travel. So people traveling out the country, they come back, and there you have it. Mumps is a highly contagious illness that is caused by paramyxovirus, according to the Centers for Disease Control and Prevention. The agency says that staying up to date with measles, mumps, rubella vaccination is still the best way to prevent mumps and mumps complications, which could include permanent deafness, encephalitis, or even death. As a physician and as a mom, I understand what it is like to try to keep your kids and your family healthy. The best way to keep you and your loved ones safe is to get the MMR shot. If you or your family have not gotten the shot, now is the time. NJDOH Acting Health Commissioner Caitlin Baston, MD, said in a recorded public service announcement. Baston added, these viruses are incredibly contagious, so if you suspect you may have measles, mumps, or rubella, it is important to call ahead before visiting any healthcare provider or facility so they can take special precautions. Officials from the NJDOH are asking individuals to be on the lookout for potential mumps symptoms, which the CDC says typically appear 16 to 18 days after infection. And they're going to list the symptoms. Fever. Mumps can start with the fever, according to the NJDOH release. The CDC says this will likely be a low-grade fever that may last around 3 to 4 days. Aches. Many people affected with mumps often feel tired and achy, the CDC warns. This can mean a headache or muscle aches. Swelling. But the symptom mumps is best known for is swelling. The virus usually causes swelling in one or both parotid salivary glands, which are located in the cheek and jaw area. Most people experience puffy cheeks and a tender, painful jaw as a result. The swollen tissue pushes the angle of the ear up and out, the CDC explains. As swelling worsens, the angle of the jawbone below the ear is no longer visible. Often the jawbone cannot be felt because of swelling of the parotid. Loss of an appetite. Another sign of mumps is a loss of appetite. This can appear before swelling or after, as some of those affected may be unable to eat because of jaw pain, according to the CDC. And that is the end of that article. So we got meningococcal disease, uptick in that spreading, and we got mumps in New Jersey, and then we also got norovirus cases spiking across the U.S. Measles, you see it here. Measles now spreading in 9 states. So what it comes down to, folks, is just being careful. You know, be careful, especially for those of you who like to travel. You're planning on going to another country. You got to be careful. There's a lot going on. There's a lot that we need to be wary of, and we need to stay informed. But let's see if I'm going to click on this article to see if about this the measles that's spreading. If they list these 9 states. Now this article goes back to February of this year. Let's see if they list these if they list the states. Go down here, it says at least 1 case has been reported each in California, Georgia, Maryland, Missouri, New Jersey, Ohio, and Washington State has so far seen 3 cases. And then Pennsylvania has recorded 9 confirmed cases, including 8 in Philadelphia. Delaware has seen 20 to 30 cases in Newcastle County. So those are the 9 states that seeing measles cases of reported cases of measles. Right, so that's 1 case each in California, Georgia, Maryland, Missouri, New Jersey, and Ohio. Washington State, so far 3 cases of measles. And Pennsylvania, 9 confirmed cases, 8 in Philadelphia alone. And Delaware has seen 20 to 30 cases. So those are the 9 states that have seen, and this is according to a February 8th article of this year. right? So with everything that's going on, I mean, get informed, stay informed, be careful out there. And I'm doing my part to help keep you informed. Be careful out there, people. Be careful out there. Protect yourself, protect your loved ones, love yourself. Watch each other's backs out there. Watch each other's backs out there. Stay safe, practice safety, and have these conversations on how to be safe, how to protect yourself. Right? For those of you who want to go springtime, summertime, you plan on going on vacation or taking a family vacation, sit down and have a conversation about it. Talk about safety, how to be safe, what to look out for, how to be careful, how to protect yourselves, right? Because you don't want to go somewhere and, you plan on, you're thinking about just enjoying yourself and relaxing, having a good time, and then you're hit with something, or worse. So these are conversations we all should be having, when we're talking to our loved ones, our family, those close to us. We should be having these conversations and staying informed and talking about how we can protect ourselves. Okay, but that's all I got. Just keeping you informed. I will be back with another video with more important information that we all can use. This is King B out. Peace.